name's Dr. Tim Nicholl, Clinic Director at Maximize Chiropractic. Today I was asked by a member in our office who has had a daughter with chronic back pain for the past 6 months if chiropractic is the right opportunity for her. Well, this young lady, she had been to a chiropractor before, I believe 6 visits over about a 3-4 month period. She was being treated for pain, no X-rays or assessment. And when she came into the office, the first thing we did is took some X-rays, found out where the problem was, why she was having the pain, and what needed to happen corrective-wise to get her out of pain and function better. When we look at the X-rays, right here what we're seeing is when you look at an X-ray, you want to orientate yourself, left hip, right hip. And on this X-ray, we could see why this young lady's spine is having some discomfort. It's not straight from the front. So when you look at this, very limited information. Even in my office setting, there's no broken bones, no dislocations. There's not much information here. Now this is usually what most doctors would have available to them even if they took X-rays. When we look at the side view of her back, yeah, you will see some injuries. There's some areas where there's pressure on the nerve roots. When the bones are not going back and they're sliding back in there, what you want to see is that the bones are nice and aligned. With her, you can tell that each area shifts back, putting pressure on the nerve roots. Even this, though, has no diagnosis code because it's not yet to an area that causes problems. So instead, what you have to look for is function and motion. There's a reason why this happened. Didn't happen with age or due to an injury. It's due to repetitive mechanical stress. When these joints push back, puts pressure on the nerve. Now the X-ray that we go back to is the front of the spine. You need to see motion-wise what happens with these joints. So what's important is that when this young lady bent her body to the left, there is supposed to be gapping or pinching and gapping of the joints. You see zero motion in between there, zero motion in between. When you don't have motion and one entire side of your spine breaks down, it puts pressure on the nerves, irritates the muscles, and causes structural issues to be repetitive in the future. Now when she bends her body to the right, this is what we want to see, gapping and pinching, gapping and pinching. But at the bottom 2 joints, they're completely shut down. They don't move to the left, they don't move to the right. Over time, that irritates the nerve. If treatment is only focused on pain, this is where the X-rays are not ever going to be used, and that will allow this to get worse. If your spine's in an injured state and you look at it on an X-ray, there's 2 options. You can guarantee further injury by leaving it uncorrected, which means that you would need to retake an X-ray in the future. If you focus on pain and dismiss this X-ray, it will get worse, it will cause further problems. Now, another thing that we want to look at is that if we were to only look at the lower spine, right? Most of the time we go to our doctor, we go in the time of pain, we look only at the segment of where pain is. Well, 50% of the time, back pain is caused by neck problems. Hold on a second. Yes, back pain is caused by neck problems, 50% of the time. When we look at this young lady's upper back, here's the reason why. If we didn't take an X-ray of her upper spine, we'd be missing some important issues. Gravitational factors on your lower back. Do you think that this is going to cause a problem with the lower spine? When we stitch these 2 things together, here's what we see. When the spine's not straight from the front, if I only looked at this area, you would not see what was causing it from above. And when we look at the spine, these curves are compensating. And they're compensating primarily because of an issue that had no pain, the side view of the neck. When you look at the neck when it's completely straight down and then you have a curve, it puts pressure on the joints. The purpose of this is that if you ignore the true cause, you will be battling a lifetime option of discomfort and pain. All too often we play too close to the death side or the disease side of our health. We're not looking at the wellness approach. X-rays like this, which are used for corrective chiropractic care, will give you an assessment to see where the body is, how long the body's been there, and when we look at the spine, having a spine that's straight, go through a curve, this will cause chronic problems in the spine, degenerative aspects here, and lack of motion down here. Get your spine checked and you'll see other options.